Darling, if you go back, just go back again. Go out and go back.
Okay.
She's muted, no? She, Streamer, muted, no? iPhone.
No. You will be on, if you have YouTube,
She can hear, but she can't talk.
YouTube, go to Haja Maru's
Streamer,
personal meeting
You are
room.
muted.
It's live now.
You are muted.
YouTube, put Haja Maru.
Hi, Glory.
Yeah, now it's okay.
Narada,
Hear me
yes.
now.
Go to Haja
Hi, Glory.
You are muted.
Can you hear me, Glory?
You are muted. I can. Yes.
Hi, Glory.
Hello. Hello.
Now it's okay.
Where is Mohan? Maru, where is Mohan?
Mohan, I'm trying to get him. He has not connected as yet.
So wait for Mohan to come in.
Maruf, MAHROOF apostrophe S, personal meeting room. Mohan is going to watch us on YouTube. We are live on YouTube. Any of you have YouTube connection, you can see that you are live on YouTube. Tell any of your friends by call and they can see you. Anywhere in the world.
Who is talking?
Maruf's personal meeting room.
He's trying to connect. No, not loud. No one.
Simultaneously, you can run on YouTube too.
It's gone again.
Where's the other one?
I think there's
Trying to connect. No.
oh yeah, I think I found a few things.
Maru, what's your YouTube?
So when are we going to do it?
YouTube, you can.
Told me already, so I should see.
There are too many Marus on YouTube.
We need to put the windows.
Right,
on there.
okay.
So maybe about 600, something over 600.
Right, okay. As long as you can set it all up. Yeah.
I thought you birthday present.
Maru.
Okay, let's see that. Anyway, we'll see.
Halima, you are
Thank you. You're welcome.
Halima, you're muted.
Right, okay. As long as you can set it
And
all
your
up.
picture video is also not there.
Okay, okay. then.
Unmute
Maru.
yourself.
Yes, close the door, you go. Okay, thank you for that.
Yes.
Thank you, Val.
Okay.
Maru, so is Mohan online? Can you start?
Yeah, Maru will start.
It's not working, huh?
Okay. All right,
Go out and come on the Zoom and try to join again. Okay.
Chief Maru.
Thank you, Val.
So is Mohan online? Can we start?
Yes,
Yeah,
we can
okay.
start.
Maru.
All right, okay, all right, ladies and gentlemen. Today is Mental Health Day. Okay.
Yeah.
Some of us need it. And then we end up with a more profound, more than mental health, ultimate reality talk, because we all seem to need it. After next Tuesday, we may have more hope. But
You think so?
yeah. After that, we can ask Padmalingam for a trip to the White House here.
Yeah.
Yeah, I think I'll be happy to invite you all. I think
seriously,
it's still in a limbo. I think until we really get the positive results, we cannot be sure of it.
Yeah.
okay, but we won't go into that. But let's, Shanthy, why don't you start and
Yeah.
Maru, why don't you start?
Start.
I think it's still in a limbo. I think until we really get the positive results, we cannot be sure of it.
Yeah.
okay, but we won't go into that.
Can you hear me now?
Maru, why
Can you hear me?
Yes, Shanthy, we can hear you.
Right, good. Okay, then first of all, it's lovely to see you all, bring back old memories. And thank you, Karunyan, for being the moderator today. First of all, I like to say that there is a slight twist to the agenda today. I was supposed to talk. Yesterday, I had a good chat with Maharu, who reminded me today's talk. And the talk on my part is going to be the mental health problems during COVID that we have encountered. Are you saying what's that from Karunyan?
1 minute.
Reminded me today. Karunyan, you're muted. Karunyan, you're muted. Unmute yourself, Karunyan.
There is a background noise of a phone. If you can all mute your phone, we can hear you. There is a background noise.
Yeah.
Can you all mute your phone, please? Yeah. Okay. Go ahead, Shanthy. Yeah.
Okay. Thank you for that. So today, I must thank Maharu for reminding me last evening about
It's
the
my
talk
problem
today.
because I put it on YouTube as well. Yeah.
And of course you did, Maru. Only thing I didn't notice that. And of course he kindly agreed to do my slides.
live
So
on
thank you very
YouTube.
much, Maru. And he's going to be the host today and show the slides as I go talk along. So my talk is really about the mental health problems that during COVID time. And I think Lawrence is going to tell us how to maintain good mental health following that. So I think most of you know about it. So what I was going to do is quickly go through some slides that Maharu kindly prepared for me. Maharu, can I have the slides, please?
Okay.
Thank you.
I'm sharing the screen. Can you all see the screen now? All right.
Right. So today's talk
on
is mental health issues in the COVID-19 era. I think most of you know about it, so this is a quick run about it. And Maharu, second slide, please.
meeting.
So going bananas in the COVID lockdown, not many of us. So the third slide. And this is what quickly run through. Most of you know about it all. This is a study that was done here in July 2020 study, which showed that 500,000 people more will experience mental health difficulties during this time. Increase in depression particularly has gone from before pandemic 1 in 5 to 1 in 4 people now suffer from depression. The other important point is that children mental health, that is the age group between 16 to 29, has rocketed by 50%. And over here, not surprisingly, 1 in 10 ambulance call outs during COVID pandemic is for mental health problems. And 50% of the 996 people surveyed, health workers, they have said that their mental health had deteriorated in the COVID pandemic since April. And the good thing is about this, that there is now for the health workers a hotline 24 hours to support them, because those who are involved in treating or in contact with COVID patients. The next one, please. Maharu, next slide. Thank you. So quickly run through some of the contributing factors to mental health issues. Most of you know already. People living with young children has a great increase in mental health difficulties than child-free homes. I think this is obvious because in March and April, when we were completely locked down, many schools were shut children were at home on top of each other, and that was quite stressful to family. Following on that, there has been an increase in domestic abuse alongside increase in alcohol and drug abuse. It is not, and drug abuse. Naturally, some people use alcohol as a form of self-medication, and as we all know, that is not very helpful in the long term. And those who are living alone are more prone. And of course, this is obvious to many people. Those who have pre-existing physical clinical conditions such as cancer and so on, not only not suffering from those conditions, because of the COVID, treatment for this has been postponed and not forthcoming immediately, and that has contributed to mental health problems. And sadly, also those who come from the low socioeconomic status, and of course in these in the States, I think belonging to the Black minority groups have also come from the low socioeconomic status. They have had more mental health issues than the others. And these have all contributed or have been contributing factors to mental health problems. Next slide, Maharuf. So just a quote, the unequal impacts of the pandemic may lead to a widening of the pre-existing health inequalities, as well as affecting people who have not previously experienced poor mental health. Again, obvious, I think most of you know that. So we'll go on to the next slide. So the mental health impacts of life after lockdown. Okay, Maruf. I think this is particularly, I think I want Maharuf sent this one. It's very difficult to see, but I think 61% of COVID where it has been affected. I can't read it properly. Maruf, can you read that? I think, right, I got it. Come back to the next slide, Maharuf. Thank you. Next slide. I think this is an important fact that you sent, Maharuf. The 61% here denotes one of the contributing factors, which is to human nature, the uncertainty. When you are uncertain whether you're going to get it, uncertain of what is going to happen the following day or in a month's time, the uncertainty is a very, very stressful factor. And I think I'm not surprised that it says here 61% contributed to the uncertainty factor. 52% it says about the job insecurity, and in our country, and I'm sure globally, as this pandemic continues, sadly, more and more people are losing their jobs. The economic problems associated with it is going to contribute to mental health problems. And alongside that, it says here 35% of the financial crises that occur as part of these two factors. Thank you, Maharuf. You want to show your next slide? Right. Anxiety during lockdown, as I said, job and financial insecurity, stress of working from home. I can understand this because my children are now working from home. It has its advantages and disadvantages because, as Deepa said, I don't need new clothes. I don't have to change clothes to go to work. I don't have to take public transport. I don't have to rush. So it has been easy. But at the same time, having to work from home and having the children around you has been very, very stressful to quite a few. Medical treatment disruptions, as I said, for cancer patients, for long-term cases, all that have been postponed because of COVID over here. Schools and college closures, social exclusion and bereavement. my daughter's father-in-law died. I was very close to John, but I couldn't go for his funeral. That happened during COVID. That was very, very sad indeed for me. Lack of access to food, and this is where the food banks here have increased in amount. People who come particularly from the low socioeconomic status have had difficulty to obtain food, and that has been a contributing factor towards anxiety. Domestic violence, as I said before, fear of infection and contamination. How many times we come, I think my hands are all dry because every time you come in, you wash your hands. I buy food, I had to wash all the food and put it away, and that has been really a nightmare for me. Next slide, Maruf. Then just the last one really here, before I talk about my cases that I have personally been involved with. Prevalence rates for mental health outcomes among university students during France's COVID-19 lockdown. Suicidal thoughts, 11.4%. Severe distress, 22.4%. High level of perceived stress, 24.7%. Severe depression, 16.1%. And high level of anxiety, 27.5%. So, and I think one of the things, thank you, Maharu. I just want to say just a little bit of some of the, here, a charity who opened a helpline. And I've been involved with a helpline, which started really to help people to come round to what their entitlements are. For example, there was this furlough scheme, the universal credit scheme, and so on. And people, particularly from the refugee population, couldn't understand, couldn't get their heads around it. So what it was, I can take that slide off, Maruf, let it be blank now. And what happened was, a lot of lawyers, solicitors, financiers came forward to give their time to help and talk to these people, because some of them were not fluent in English and they didn't know what their entitlements were. Not surprisingly to many of you, after some time, people were telephoning through the helpline asking for help to contact their GPs, because GPs were not giving face-to-face appointment. It was all through the telephone. So we got involved, and I'm sure not surprisingly, not only physical problems, mental health problems surfaced, and that's how I got involved in talking to these people whose mental health problems became worse during COVID. For example, I want to talk about a girl. She was the youngest of the family. The older two were boys, very clever. So the family was very thrilled when this girl was born. Sadly, she had a learning difficulty. And I think the parents couldn't accept that, because these two boys in this country, the mother, particularly the mother, pushed them and they got through the 11+ exam and went what we called in the grammar school system, which is almost you don't pay, but you get a public school education. So they were very clever. So you can imagine how disappointed they were with this girl who had learning difficulty. So this girl, they didn't want to put her in special needs school, but instead they put her in what I would say normal school, but with special education, which meant the child had some difficulties, but she coped. But during COVID, with the school closures, erratic attendance, she couldn't cope with that particular aspect of it, and she began to get bullied and teased. And what she did was she started to pull her hair. And within a couple of months, now she has lost all her hair. She has to wear a hat, and the mother cannot accept that. So the more important for me was to really to talk to mother and get help to the child through the mother. So it has been a difficult problem for me supporting this particular mother. Another case is where it was very sad. This was an autistic boy who just turned 18. Unfortunately, in our country, When you are under 18, you fall under the child services. Over 18, you come into the adult services. Normally, even during this transition period, there is no continuity of treatment is lost. And the damn COVID came in the middle of this, and this autistic boy was left to deal with it all. He was on medication. The GP said now he's on 18. If he doesn't want to take his medication, you can't force him to take medication, force him to take his medication, because the parents were slowly putting the medicine in his food and trying to give it that way. So the medication was stopped. He was getting worse and worse. You wouldn't believe, when I was talked to them first, for 3 months, he had not had a bath because his obsessive compulsions had become worse. He was hoarding things in his bedroom, and he wouldn't allow his parents to come into his bedroom, not allow them to open the window. The parents said, oh, he so smells so much. And when mother did that, what happened? The boy got angry and just went and slapped the mother, but she started to bleed. You may wonder why. Because for 3 months or more, he had not allowed his parents to cut his fingernails. The fingernails had grown so much, it had become like claws. So she started to bleed at the back, and they had to call the ambulance. The ambulance men came and said, what do you want us to do? We can't take, do you want us to take him to custody? Or so the father was a very clever man. Paul said, hang on, just wait there. You will just wait there. And while they were there, because under their notice and under their eyes, the child allowed them to cut his fingernails, but wouldn't allow them to cut his toenails. But that was how he was managed. But luckily now we have managed to get some respite care for the boy, and he's in respite care. And thanks to COVID again, he can't come back home. So he's quarantined in the respite place. So these cases, what I'm trying to say is, those who had mental health problems has increased, and those who had not had mental health problems has, I have had another boy who was in his university, second year medicine. He had gone down with depression, and he is having treatment. So this is not uncommon during COVID for these things to happen. So I think what I said, most people would have already know about it. So what I want to do now is, Karunyan, can I have another 5 minutes more? Karunyan, you're muted. Okay, Blue Jay, right. I want to say something that may be...
Shanthy,
yes.
1 minute. I think, the time, Maru gave some timing, but I think these are conversation. I think we are all unemployed. I think we can afford to spend a little time. So go ahead and take the time and build, unless anyone has strong objections. Okay, so let's go ahead. Yeah,
I want to talk about Karunyan, about another thing that happened among the things in the community here, which is what we did is people still have the stigma towards mental illness. They view mental illness, they want to shove it under the carpet because it's a stigma. If there's a mental health problem in our family, nobody will come and marry my daughter. So everything is covered up and goes on until it comes to a point when it is really severe, then it becomes something very catastrophic happen, or it will become too difficult to treat or takes longer to treat. So one of the things we did through this helpline is, for 12 weeks, we had what we call increasing the awareness among our community, and various mental health professionals talked about it. So people are now aware of this problem. So there is towards this to stigmatize the stigma to go away, and they can get help at the correct time and thereby help people correctly. Because if you're aware, look for the symptoms around you, and really kindly guide them towards the correct people to get the treatment. I see Maharoof has gone, so which is sad. Right, he has come. Maharoof, I want to talk about lastly something. This is a rare incident. It doesn't happen often, thank God for that. But when it does happen, it happens in clusters. But sadly, these clusters happened during COVID times among our community. And people may have heard about it, read about it. And I want to talk here about familicide. That is, the perpetrator kills members of his family, and in 50% or so, 80% of cases, they kill themselves. So the first case I want to talk, because it all came in the newspaper, so there is no confidential. I want to going to show the photos. Maruf, can I have the first incident? Maruf, you're muted. No, other one. I think Maharuf is muted. Maharuf?
No, I'm all right. Don't worry.
Okay, thank you for that. Can I have the first slide of that? Thank you. Right, this is incidents first. You can see how beautiful this lady is and her son taken on a particular occasion. And these Malaysian Tamils, they came to this country about 5 years ago, married 5 years. The boy is 3 years old. And they lived in an apartment. And the people there said they used to hear during these COVID times a lot of fights, noises, arguments, and so on. And after that, it stopped for about 2 weeks. So they raised the alarm. And when they went in, the man killed himself. And to find the dead bodies of this lovely woman, the 3-year-old boy, and sadly, the dog, which was a poodle, also dead. So the man had not only killed them, he had stayed there with the dead bodies for almost 2 weeks till the alarm was raised. And one of the things that did happen was, it was quoted by one of the neighbors that during one argument, the lady had shouted at him and thrown some stuff out of the window and said, "Go and take your medicine." So the speculation is that this man had some mental health problems. He hadn't taken his medication, and that he had done this, what we call familicide, which killing his family members and himself when the police forced open the door. I just wondered whether, for me, I was always, in our family, my father was very fond of animals. So I grew up with animals and dogs around me. And for me, when I heard that the poodle dog was also killed, people said, my God, they used to take this dog for a walk, were very loving toward the dog, and he killed the dog. What do you people think? I'll ask Karunyan, he's the moderator today. Why do you think the man killed the dog as well?
Well, he killed his child, he killed his wife. And, in the hierarchy of things, we also have given the animals a very high place, but still he's part of the mental illness. I don't see it as a special phenomenon, except as the fundamental disability or disorder that he had, possibly a mental disorder which was controlled with medications that got uncontrolled. Is that right, or do you have more insights?
Yeah. I think you're right. For me, although people commented in the news afterwards, why did this man kill the dog? For me, one of the causes of familicide is when the person is so depressed, when they call it comes into a psychotic depression, or when you are so depressed, severely depressed, you see everything is in dark gray tones, and you feel your emotional pain, and you see the people around you also with that gray eye, and see them also suffering as if they are also suffering your emotional pain, and you feel almost like for a better word, a delusional altruism. I'm going to take them all with me and thereby get rid of their pain as well. So for me, on reflection that night, I thought, oh my God, this man must have loved his animal so much, it must have been like part of the family that he didn't want to leave the animal behind, you know, and that is one form of family side. Okay, thank you, Karunyan, for your input.
No, but just a very interesting way of viewing the event. So is family side and killing loved members of the family or loved animals, is that part of a altruistic action, as you say, or is it a hateful action?
Or is it a?
Hateful, is it an action of anger?
No, no hate. I don't think.
I think it is a.
No, anger, when I say anger.
I think in this case, it is usually almost a delusional thing that you think that you're saving everyone. You're saving that person from that emotional pain that you yourself are going through. You see that emotional pain in others, which is not true. That's why I call it delusional. You think they're also going through that pain, and that's the best thing is to do, is to get them out of this pain. You're doing them a service.
Saro wants to say. Saro, you are muted.
Saro, yes, Saro.
Saro, you are muted.
I find it difficult because Saro's questions are always difficult. Go on, Saro. I like your way of thinking.
Saro, you are muted, Saro.
You're muted, Saro.
You are muted. You have to unmute yourself, Saro. No, Saro, we can't hear you. Go to the right-hand corner, Saro. There's a blue box.
I think she didn't hear. Maharoop, have you got a number, or someone got a number to tell her?
No, I told her to unmute.
Saro,
Yeah?
Saro.
Can't hear.
Saro, there's an unmute yourself.
Can't hear.
Saro, can't hear. Saro.
Okay, I got
it.
Thank you.
I was going to say, Shanthy, just one thing. If it was done for altruistic purposes, he should have killed himself the same day that he killed the wife and the child and the dog. He was alive. It was only after the police came in that he shot himself. So I find that a little bit hard to reconcile.
Yeah, I think you're right, Saro. I found that also. I was thinking about it, and one of the things that this is purely speculative. Nobody knows what really happened. I think for having been in the same house, not gone anywhere with these people, dead people around him, I just thought how much difficulty he must have had to separate from them, to separate the dead bodies. As if to me, I'm talking purely speculative, that he found them part of himself and that to leave them was not possible for him. And only when he found that these people, he had to leave them, they had to leave before him, that he killed himself. But that question is a very good question, Saro. I don't know the answer. As I said, it's just speculative. Almost his attachment to them, he couldn't detach himself.
Also, one thing more struck me also. Sometimes, the child and the wife might have loved the dog so much and he wanted to hurt them with killing the dog before he killed the wife and the child too. Whether that's the reason he killed the dog was another thought that occurred to me.
That is possible. That is possible. That's a good point. But only thing, something against saying that is that the neighbors, they have said that all three of them used to take the dog for a walk and they were very loving towards the dog. So we don't know exactly what happened. It's very difficult to know what exactly happened through the person's mind. But what I want to stress is that say that family side or thinking like this, killing, murder, doesn't happen. He just snapped. Usually it is a long-standing thing and it happens. But usually there's a mental health problem.
Shanthy, anyone else? Anyone else question?
Yes, Karunyan, I've got a comment on that.
Yeah.
Can you hear me?
Yes.
Yeah, I can. Go ahead.
All right. These are called total homicides. There's a lot of research on it. It's mainly in the context of domestic violence and patriarchy, that is to say, males controlling the situation. In 70%, there's a long history of domestic violence and of not going to the police. There's no police record. And this tradition of killing everybody, including the dog, was common in Egyptian times, and it's part of a male concept. I think the mental illness rate's actually quite low in the research. It's near a third to 40% at the most. So these are more about patriarchal families and males and their concept of total control. They're often the jealous, possessive type is the most common form of murder in these cases. In the US, it's much commoner, for example, in traditional patriarchal families, such as the Hispanics. That's the differential statistics on this.
I think
Thank
you're
you,
absolutely right, Lawrence, but I was thinking your family size in general, there are other reasons for paranoid, morbid jealousy, and so on that promotes this, in some case, complete annihilation. But I was taking, sorry, thank you for that, Lawrence, but I was taking this particular incident in this case alone, where it seemed to be to people that it was psychotic, delusional, sort of almost altruistic. But you're absolutely right. There are people, there are the other causes of family side is paranoid schizophrenia, morbid jealousy, and so on. But I think that is sad in this case, it happened because of this reason. But thank you for that. I was going, if we talk about family side, we can look at all the various reasons. Thank you for that.
Yeah, thank you, Shanthy. I just have one short question. You know, there are a few countries like South Korea, Vietnam, and now Sri Lanka until recently, which has substantially controlled the infection, the transmission of the infection. They had, in Vietnam, for instance, is now activity is normal, but they had a period when it was not. So my question is, in countries where there was strict lockdown, and even China, I suppose, had there been similar problems? In other words, is this a function of lockdown, or is it a function of, what is the function? Has Vietnam shown the same degree of mental illness uptick?
I think that's again a very valid question. I don't know the answer, but I think what happens is this particular, that's why I said I'm talking at the end of my talk. The mental health issues that I talked about COVID happens is global. But this family side, thankfully, is rare. And when it does happen, it happens in clusters. And why it happens in clusters? Is there a certain element of copycat behavior, or somebody wants to do what the others become part of this thing? We don't know. But there are many, many reasons for family side. And one reason here in this particular incident is when I talked about that in this particular community, this man had a mental health problem, and this happened. I'm going to talk about the second case, and then from there we can talk about general family side. Because one of the other things that Karunyan, what your question is a good question. Again, a family side has happened in Japan and so on before COVID, where everything was normal. They didn't have the lockdown. Is economic, when a family, the man, the head of the household, invariably the man thinks of his economic success, his success in the world. He has made his money, he's wealthy, and he sees the family in good health, in going to independent school, living in big house, having so many cars. It's an extension, or it's a symbol of his economic wealth. So when he goes bankrupt, there has been cases where he has killed not only himself, but his family, because there is no one now going to put his symbol of his economic wealth. So that's interesting. But we're talking about the COVID cases that happened during this family side. I don't want to take more time. Thank you for that question. This is again, this same family 3 years ago, how happily they were married 5 years ago. Next slide, Maruf. And this is the second situation. I think you may have heard this because this also family side, different reasons. This one is this man with 2 children. This happened in France, a Tamil family, where apparently, again, he's supposed to have COVID, recovered, but he had become mentally ill. And then what happened? He killed his wife, the 2 children, and then he called his sister who lived nearby. The children of his sisters came first. He killed them. And because the sister hadn't come, he called his sister. They came, and there was, by this time, someone had alerted a shop owner. So what happened was 5 people were killed, 5 people critically injured, and 1 was him and taken to hospital. Now, the reason I don't know, again, can be speculative. He had corona and he had mental health problems. And we were talking about it this morning with the person who runs this helpline, and he said he has contact with the French police, and that's something we may be able to do to find out whether there are any more reasons why this particular family side happened during this time. So I said the reasons for family side, as Lawrence said, can be many, but I'm talking about the specific instances. Sorry about the time. The other slide, Maharoof. Right. This really brought tears to my eyes when it was reported, because this happened near my place where I live in Mitcham. This is the pretty girl. Here the mother, again, this is where when we talked about increasing awareness, these parents, the mother, father, the boy, elder brother, and this girl lived in a flat above a shop. And during this COVID time, of course, the father was going to work. He was earning a little money in the supermarket. He used to go to the supermarket, or he was a supermarket worker. And the mother had said many times to people, oh, I feel really depressed. I wish I was dead. And I think if I die, who is going to look after my daughter? My son, my husband will look after. There is nobody to look after my daughter. And she had verbalized these thoughts. And in one of the things that we did stress on increasing awareness is, people do in some way indicate their feeling, and people around them should really take note of it. If only people had taken note of it, I don't know, and taken her and given her their help, it had been a different consequence. But some people think if someone is depressed, he's staying indoors, doesn't talk to anybody, to ask him whether are you thinking, contemplating of killing yourself or killing anybody. That itself, the question itself, may push him to kill someone. No, I think it will be a relief to the person to know that you have asked the question, so that if he had those thoughts, he may verbalize it. And this never happened to this mother, so she had said. So one day she planned it well. Her husband was coming back from work at 5, she knew. Her son, 10-year-old, usually goes and have the bath at 5 o'clock that evening. When the father comes, that day she said, go and have the bath at 4 o'clock. So sad. She took the daughter to bed, slit her wrist, slit her throat, and then stabbed herself in the stomach. And when the boy comes out of the bathroom, sees them, the mother and sister there like that, and of course raises the alarm. The next door neighbors come and see the girl is dead. The mother is in a unconscious. Ambulance takes them to hospital. Sadly to me, the mother underwent about 5 to 6 hours of operation, and she has now survived. But she meant to kill herself. Sadly, she didn't die. So this is where, when we gave her increased awareness series on mental health issues, is that you should really take note of what people say, look at them, take them, understand them, and give them the help they need. And this is the beautiful girl. She was 5. Everybody said she was a very happy-go-lucky girl who died. So I think, as I said, and there was another case not very far. There's a 4th case. 4 cases happened. That father, I don't know the details, killed his wife and 2 children and killed himself. So why I'm bringing it together is these things has happened during COVID. It may have just been an incidental, but it happens in clusters. Is it a copycat sort of behavior? Because we know in children at schools, when one develops anorexia, you will find the whole class become anorexic. Or when one child cuts, the girl cuts herself, her wrist, there is an epidemic, everybody is cutting their wrist. So there are many, many reasons. In mental health is a complex interplay of many, many factors. It can be genes, is it the nurture or the nature? Is still a question, but at the end it's a complex interplay of a number of factors, but at the end what happens is what we see, and which in these cases was very, very sad. So I'm sorry, I'm ending on that note. I had taken more time than I thought of, and I think, thank you for that. And I think, thank you, Karunyan, and thank you for asking me to talk about this thing that I've been involved recently. And I think I leave it to Lawrence, who's going to teach us how to maintain our good mental health. And as a prelude, I think Maruf has some slides to show Lawrence. So I leave it at that.
Okay, thank you, Shanthy. Thank you very, very much. I think, has anyone got any questions for Shanthy? 1 question, 2 questions? No? Okay, then let's go to Lawrence. Now, Shanthy has told us the problem. Lawrence is going to tell us the solution.
Yeah.
At the end of Lawrence's meeting, we expect all of us to be very happy, cheerful, and upbeat. Okay, Lawrence?
Okay, have I got the screen?
No, you're on the, you're not, you don't have the sharing. You have to share the screen.
Okay.
You are good. Yeah, that's good.
Okay, all right. All right. COVID is a complex problem. You have the disease, that's what most of us talk about. You have the healthcare providers, you have the patient, and then you have their relatives, and the psychosocial impact of the disease and its consequences for the population. Then there are the efforts to combat the outbreak. There's big battles, especially in the US, about government rules and regulations, and masks are becoming a political issue. Lockdowns have had effects like what Shanthy has already told us about, and they're quite dramatic. And Karunyan, you asked the question, is it the lockdown, is it the COVID? The rise in domestic violence has been gigantic, especially in BAME populations. And yes, in Vietnam, there were 2,500, there was a 250% increase in women seeking shelter. So it's got nothing to do with the disease itself. It's the process of lockdown, living with, especially if you have young children. The pressures are quite intense. Also, not being able to see people, the physical distancing and the sense of isolation. And especially if somebody falls sick, the anxiety about looking after another relative are quite complicated. Then we have another whole battle in the media. It's not just in the US, it's here. The internet has some very cleverly made misinformation campaigns. There are groups of doctors running misinformation campaigns. You should watch Pandemic 1 and 2. They're quite important if you're dealing with people because they have important impact not just now. Already 45% of people in the US say they won't take the vaccine. So the whole way, and countries where they were able to contain for this, handle the outbreak better. That means to say where you had nationalistic politics, like in the UK and the US, the death rates were very high. So the kind of public discourse on the issue has an effect on mortality. And if you look at the more nationalistic places like Brazil, the only one that's curious is Belgium, but they've had a long-running battle between the Flemish speakers and the French speakers. So there are other issues. But as a general rule, the more cohesive the country, the better the outcome. And the less the nationalism, the better the outcome. Okay, I want to remind people, because this came up in a previous discussion, this is not just a psychiatric disease. It has neurological manifestations, and we are not clear how the virus gets into the brain. Is it via the blood, or is it up the olfactory neural pathway through your cribriform plate? My bet is it's direct because of the loss of taste and the loss of smell, which are symptoms of it. And I think we all now know that it's through the ACE enzyme site. The consequences are meningitis, encephalopathy, seizures. I certainly know of one case, in fact, a psychiatrist colleague who developed delirium following the infection. So there are neurological aspects that we will know over time. Already we have long COVID. Incidentally, the associated factors for long COVID are obesity, being female, and age, as well as having asthma. So, and I've seen PTSD type symptoms in healthcare workers. Now, the other factor we must remember is that this is a hyperimmune disease. There's an exaggerated response. There have been cytokines storms which preceded mortality in a lot of people, and it may explain why corticosteroids are so effective, at least in the short term. It also has an impact on coagulation, so the impact of mini strokes. And if you remember the lecture I gave, depression is a hyperimmune state. So you can see some of the neurological and physical mechanisms involved in this disease. What do we learn from pandemics? Now, there's a catch. I disagree with some of this research and the inferences, because I think the 1918 flu had a very marked neurological component from the very beginning. It's what caused a huge amount of Parkinson's disease, for instance. So what we can infer directly is limited, but to take it as it comes, in the study in Norway showed a massive increase of first-time admissions, and people had continuing symptoms which were psychiatric, and we know there was an encephalitis associated with that. There was also in the US a massive increase in suicide, which when you look at the figure, it's only when the peak is going up. It's very short-lived, gigantic rises in suicide. Soon as the incidence fell, the suicide rate fell away. So it's a bit of an odd phenomenon. And though there has been a lot of hype on suicide, the number of people presenting certainly to A&Es has fallen. On the other hand, I know from my own trust that the number of crisis referrals and sections have increased dramatically. Okay, now I'm going to focus on suicide on healthcare workers, because that's the area, that's what we all are. And you've got to remember we have a very high suicide rate.
Lawrence, do you think you can do the show? It will be bigger and...
Okay, all right.
Lawrence, one question.
Yeah.
These rates of 44% is during COVID, or is it pre-COVID?
No. Generally. Doctors are famous for committing suicide, especially psychiatrists, anesthetists, and dentists. So we have a high rate, but in the US, we've seen several doctors commit suicide, and there was a cluster in some other countries. This is the data from Wuhan, and as Shanthy has already...
Lawrence, you can do full screen and as well as do the show.
Okay, I've got a problem with my computer.
That's fine, that's okay.
Okay. But it's okay.
It's okay, it's okay.
All right, okay, all right. All right, so general distress, Shanthi's already covered this, and she's already covered. Now, this is a big problem. In England, we've tried to anonymize it, providing healthcare. Doctors don't come for help. They've come, and nurses, slightly easier. And I certainly run an anonymous site without any records because of this problem, but they're paranoid about their details out. And this is something we need to be aware of when we're dealing with medical staff. Now, one of the factors that comes out of the Wuhan study is that people who didn't get sleep, especially in that first wave, that the staff broke down and took time off at much higher rate. So creating shifts was very important. And they developed telemental health facilities at a much faster rate. I mean, all of us are using Zoom. I'm not using Microsoft Teams because it's through the hospital, and having sort of secure means of people contacting you is a problem. It's also interesting, if you offer anonymous telephone counseling, you get a much better response than even Zoom. People don't wish to be identified, their staff, and it's important to recognize that some of these concerns are genuine. Now, what are the signs you need to look for? I'm finding anger and irritability is a very important one. Some of it may be vented at public figures, but sometimes it's at other staff and especially family, as Shanthy has talked about. Feeling betrayed and unappreciated. In the first wave, people were very angry that they didn't get PPE and at the failures, and that was a massive failure. I'm shocked the US hasn't reacted. This kind of cynicism, there's no point, there's nothing we can do, is a very serious warning sign, but it's not unrealistic. It's important to acknowledge that. Getting information overload is a big problem. There's so many people saying different things that people become mistrustful. Also, I'm seeing two things: heroic, people who work mad hours, volunteer, help out, and I'm also seeing complete flat out. And you see both of these two extremes. You've got to watch for the extremes. Some people take on a very heroic, grandiose role. Other people feel abandoned. This is a crucial one. When people stop shaving, washing, not sleeping, watch out for this. These are fairly traditional signs of stress, developing depression. Addiction rates are going up at a massive rate, and that's including staff. So watch out for the smell of alcohol and or the other drugs, especially drugs to keep you awake. Okay, if you look at the ones associated with bad outcomes, one is denial, continuing to act as though, not socially distancing, continuing to have as though the illness doesn't exist. You might think doctors don't do this, but I know one close colleague who's currently on holiday and traveling around saying, oh, you can get more bargains. So denial is quite common even among professionals. The other one is a kind of intellectual, oops, my cat just came to me. Okay, being very clinical about it and talking about things in very abstract terms, not really facing the pain and the reality. That's related to isolation, especially if they've had a loss or they have concerns about being quite intellectual. The other is projection, blaming it on colleagues, the management. And the problem is management is making a mess. I mean, my hospital is completely screwing up. Quite realistically, so how you distinguish it from the other factors is an issue. The other thing is a kind of nihilism. I don't know whether you saw that guy on Fox News who said, oh, these people who have diabetes are going to die anyway. Why are we wasting time? Let's open the economy. So there are people who are openly advocating a kind of the people who are dying are the lower socioeconomic groups. We don't have to worry too much about it. I think somebody who appeared on Fox News said, if you open the schools, only 3% of children will die and more people die in swimming pools. So there are all sorts of immature, difficult rationalizations that people make. But I'm also seeing excessive anger as being a very important issue, and that may be a factor behind the murders that Shanthy spoke of. So these are happening to normal people, not in any way previously disturbed. Both the illness and the process of lockdown, a way of coping with the illnesses, cause serious problems for people. Okay, now these are very important in terms of management. People feel that their lives are out of control. This is one of the known factors associated, a little sense of control over one's life. There's nothing we can do. This is overwhelming. The way to tackle this is to have clear plans. What if one of the commonest fears for doctors is that they will, and healthcare staff is that they will get sick and they will bring it home. So having a clear plan, if I get sick, what will I do? And having stocks and making arrangements for your home, how you would isolate in your home. And remember, this is not a short-term issue. This is probably for the next 2 to 3 years. These are permanent changes that are coming, and having plans. It includes making plans for our deaths, because that's what many of us are facing. And I've already been to one Zoom funeral. So there is going to have to be adapt to a new situation. We are going into one of the biggest transformations of our society. The sense of cohesion with others is important. And here we have some interesting data. There's a study just come out that depression among young people has fallen because their social life is on the internet. So in a sense, and they've also had more time to sleep, which is, we know, is a risk factor in young people. They tend to stay up late and get up late in the morning. They don't have to travel to school, so they can sleep in. So it's interesting that, so we are going to have to relate to others on the internet. And as I was saying tomorrow, setting up meetings like this is part of that, that the way we relate to other people is going to have to change. It's going to have to be either in open spaces or on the internet. And we need to be able to make close relationships with significant others. So if you see signs of little self-control, negative emotionality, and sort of this, I want this, like somebody said, I'll isolate for 10 days, but after that I'm going out. This isn't for 10 days. We're going to have to take precautions, the face masks, the distancing, the hand washing, the altered ways of working and of social relationships are going to be permanent for the next 2 to 3 years. So connections, pro-social organizations. Sense of humor is very important. Circulating jokes has become a tradition among people. Among family factors, we really need to help people cope with small children, teaching them to structure, creating patterns to the day, creating trust and relationships, giving them a sense of the future, but above all, clearly planning based on what we already know. And the more we know, the more we can plan. And accepting change and adaptation is going to be quite important. So participation in schoolwork, keeping children together, they have a slightly lower risk. So one can take a slightly higher risk with children than we do with adults. The problem is they then carry it home, and social distancing from children is almost impossible. So ineffective parental supervision, family conflict, as Shanthy has very dramatically told us, the pressure on families is enormous, and teaching families how to live in this adapted state is very important. So you need to treat not only the individual, but also the social system in which they live, and creating links, creating connections between family members, teaching them ways which, and sometimes it may be just planning physical geography of their homes. Also having plans if one of them gets COVID, how they're going to isolate. Remember, bathrooms are a big source of infection, and how the bathroom is used needs to be planned for. So stocking up on medications, stocking up on food in anticipation of the possibility. The more one gives people a sense of control, that they can do something about it, that they can change, they can adapt, that this is a plague, we need to live with it and survive it meaningfully. Giving them that sense of hope and trust and planning, and that's realistic, is one of the key strategies. People ask me, what do you do if somebody starts showing emotional disturbances? First thing is make a connection, set up an opportunity to talk. I strongly encourage them to keep a journal, and for some people they prefer a video journal, which is fine with the technology people have. Helping people to be computer literate, as Maruf is doing, is a very important skill. In 1990, I was involved in a medical school trying to do telemedicine, and you couldn't believe the level of opposition. Today, I'm shocked at the people who refuse to do email, now being very literate with Zoom and all this. So the technology is there. We need to become technical, and the provision of hotspots and helping people improve their computer literacy, because the future is going to be through the computer. And that's how we are going to relate, and that's what we need to adjust to. Finally, I'd like to give you a 4-factor model of thinking about this. The physical aspect is paramount. So sleep, exercise, diet are 3 crucial areas. And if one tip I can give anybody, if you have any abdominal fat, get on a diet, lose it, because 40% of our cytokines come from our abdominal fat, and we Asians have abdominal fat. So if you haven't, so forget the carbs, forget the trans fat. So having regular exercise, having regular sleep, and managing the physical side of things is very important. Emotionally, keeping things positive, having a sense of the future, learning to self-regulate emotions, whether that's by talking, whether that's by cognitive behavioral strategies, whether it's by religious meditation. But the important thing is to see how not only how you're feeling and how other people are feeling, and helping them regulate the emotional side is very important. These are fairly classical signs of stress: the attention span, the rigidity, the irritability, and the lack of tolerance. This worries me. We seem to have institutionalized intolerance. We are it's become a social norm. So the willingness to accept that other people have different viewpoints and that mental flexibility and being inclusive has at no time in the world been more important. So tolerating differences is something that really needs to be emphasized, and working with people who have different viewpoints and trying to meet them halfway. And finally, if you have some kind of basis, a set of core values about what you believe, and the flexibility of tolerance of others, it's very important. So in terms of people, what I suggest is that they have clear structures. I mean, talking personally, I have a clear structure to every day of the week, because when you work from home, you lose all sense of it. I'm doing yoga classes twice a week, though I could perfectly well do it myself. I've enrolled with a remote gym. I also have a fixed routine. I also have regular setup meetings with people and structuring the work. So starting on courses, having a structure, having connections. Some people are gardening, but both also having regular exercise. And I don't know whether you know about Joe Wicks, but he's taken off in England. Exercise is a very important aspect of this, as Maruf will tell you. So having a structure to your day and maintaining differences between days, having a belief system, having plans for outcomes, and this involves financial planning, especially for children who will have problems in the job market, because one of the big changes that will come on this is the artificial intelligence revolution, which is already on its way. This is the biggest boost for it. And that's why I would recommend reading this book. If anybody wants it, I can send them to it. I've also got it as an audio book. The world is changing, whether or not Trump is re-elected. We have changes afoot, and we need to look at these changes, plan, and you need to take back control of your lives. This virus has created a sense that we are not in control, the government is not in control, that we are in a state of chaos. So giving people a sense of autonomy, that they have a plan, they have contingency plans, and giving them purpose. So I don't know, I dropped the slide on volunteering. All right, going back to that. Go back to love, relaxation, hobbies, physical, psychological, spiritual. These are very important, more important than at any time in history of our lives. So we're living in exciting times, whether we sink or swim. There are things we can do about it and live through it meaningfully. Thank you.
Thank you, Lawrence. Wonderful, wonderful words of wisdom, so well put. It was really, really good. I have a request for you, but I'll wait for questions from anyone. But truly, very wise, wonderful summary, Lawrence. We're very proud of you being one of our batchmates. Any question? I have a request, Lawrence, at the end of it. But any questions?
Lawrence, you can stop sharing the screen if you like.
Okay, I have a cat who's demanding to be fed, who's bothering me, but she walks all over my keyboard as a means of distracting my attention.
Okay. Any questions for Lawrence? Everyone is speechless.
Yeah.
Oh, of course.
Can I just thank you, Lawrence, for that very wise words on how to control our emotions during this post-COVID and to get over it. I like your last words about that we live in exciting times. I thought that was very, very interesting. And I think is really alongside that comes about tolerating uncertainty. And that's what makes people quite distressed and not sure of what's going to happen and looking over their shoulders. I like your word,
Hi, Mohan, you're back.
positively, to think that we live in exciting times. Thank you for that.
Thank you. Anyone else? Mohan?
I never left anywhere. I just looked at slides. That's all. I was seated here.
Okay.
Anyone
else with comments?
I just want to say, I want to add my thanks to Lawrence. I think it was really wonderfully done. A lot of good information, lot of things to think about. And so I appreciated it very much. And thank you, Shanthy, too. It was, they were both
Yes, thanks, Shanthy. Yes.
Based on that, I have put a small video on the SLIMO 1966 WhatsApp.
Okay. So, Lawrence, can I ask my request of you?
Yes.
Okay. Lawrence, can you, what you said was medical and just for life and very relevant to a lot of people the way you summarized it. So my question to you is, can you take the essential practical aspects of it, leaving out necessarily the statistical or the other things, and give some outline of 6-7 areas of life in terms of creating connections, getting competent in computers, practical things that we can then give it to others. I'm thinking particularly of my friends' children, and they're all going through the same thing, schooling at home and so on. And can I just to pass it on in simple educational, instructional words of advice? Can you formulate something that can be circulated informally, at least to some of my family members and friends' children?
Yes.
Definitely.
I'm sure I could work with Shanthy. She's more familiar with children, and yeah, we could put something together.
See, the issue of structure, daily structure, keeping diary.
Yeah.
Actually, I have done some of these things just out of thinking through how to go through this, and also the feeling that is going to be there for a long time, and also giving a positive twist, as Shanthy said. It's an exciting challenge, and as we meet the challenge, we'll grow kind of attitude. If you can put that together and circulate it maybe amongst us, and then we can give it to others.
Yes.
Both of you, I hope you don't mind that our sharing your slides with all our colleagues.
Yeah, no, that's fine.
That's fine. Okay. Thank you very much.
Hi, Bobby. Good morning, Bobby. He just came in.
Yeah, he's muted. Bobby, you're muted. You got to unmute yourself.
Anyway, good to have you. So all right. With that, any other questions, comments, criticisms? Everything welcome.
Narada is ready, or?
Okay, then we go to the more important of all these talks.
Death. Mortality.
Okay, so the subject is, I'm okay with everyone to go on, right? So the subject is the dilemma of mortality, and then after Narada finishes, let's talk about our next meeting. This has been a fantastic meeting. Let's talk about the next meeting. So Narada, you are on. Then unmute yourself, Majan. Narada, you got to unmute yourself.
Okay, all right. Yeah, thanks. Thank you, Karunyan. The only thing is I feel a big fraud now after Lawrence's. I don't know whether I should go on with my.
No, go on.
But I think I want to anyway go on, because my remit today is to annoy our moderator and Saru. I think these are the two people who are which I realized that are very worried about this COVID business. Now, my first slide I will show you. Now, these are all figures mostly from from England. England means in the United Kingdom, but mostly from England and Wales. Now, if you look at the first slide, I hope you can see it. Roughly, there are 10,000 deaths a week in England and Wales.
Wow.
I think in January it was 12,000, then it goes down roughly, and then again November, December it goes up to about 11, 12,000. That's the per week. And in March to, I think it's the week number 14 is, I think, 11th of March. You can see that the number of deaths have been going up to nearly 20,000 by April. That is week number 12. Week number 12, yeah. 16, sorry, yes. And now you can see the dark blue line, the lighter blue lines, which are the COVID deaths. And the next slide will show you it in, unfortunately, you know, I'm very bad at this PowerPoint thing.
Narada, go back to the first slide, Narada, for one more second. Go back to the first slide.
First slide?
Yeah, first slide. I want
previous
to
slide, previous slide.
Previous slide.
This one.
Yeah. Give me 1 minute. Okay. All right. Okay. Fine. Got it. Yeah.
Okay. Now, as you say, now week 40 here at the end is the 2nd of October. And now we have these are all from the Office of National Statistics, ONS, in England. Okay. Now, on week 40, you see the normal deaths about 10,000 a week and a tiny blue line at the bottom, but that is about 100 and anyway, in the next slide, you will see
343 COVID deaths. Yeah. It's sleeping the number. Hey, you're muted. Narada, you're muted.
Narada, we can't hear you.
Okay.
Okay. Now again, this is the same slide in numbers. Now week 11 is the 13th of March, week 11. The normal deaths in England were 12,000 in that week, and there were 114 COVID deaths. And as you go down, you see the COVID deaths were increasing. And it went up to about 6,000, 9,000, 6,000, and like that from the 16, 17, 18 weeks. Then, as you can see, gradually from week 24 onwards, the number of deaths were coming down. And in week 30, it came down to 83 per week. And since then, it has been going up again. And this is the second wave. And now you can see the number of deaths, the normal deaths have been remaining more or less the same. Now it's about 11,000, 10,000 per week. So now week number 40, which is the last one there, is 2nd of October. Now I have the things for week after that. I think it is gone up to about 400 something per week in week 41. I think I would want to tell you something. The next slide. This is a very important slide. I think this is what I think. This unfortunately, I didn't know how to put numbers to these. Now, if you look at this slide, this is a very important slide. A number of deaths involving COVID-19. This is again in England and Wales. Okay, between under 1 year, there were only 2 deaths under 1 year, and they were both male. There were no female deaths under 1 year. Between 1 to 14 years, there were 4 deaths. I can't put these numbers, unfortunately. I didn't know how to put the numbers on there. So 1 to 14, this is from March to October. You must realize this is a very important slide. Under 1 year, there were only 2 deaths of COVID from March to October. 1 to 14, there were 4 deaths, 2 male and 2 female. 15 to 44, there were 352 male deaths and 228 female deaths. Then from then onwards, it rises, you can see. 45 to 64, 3,341 male and 1,756 female. Then like that, it goes up. And always you see that about twice the amount of males die up to 85. From 85 onwards, more females die. And that is, has anyone got the answer to that?
There are more females.
That's right. There are more females left. Most of the males
They
are
are a
dead.
superior breed.
Yeah. Now in England, there are 564,000 males over 85 and 939,000, almost twice. That is 500,000 males and 1 million females over 85. So the deaths here is 10,304, 10,300 we'll say, of males and 12,000 females. So really the females overtook males only after age 85.
Only the deaths, but the ratio, no.
Yeah.
The ratio is still smaller. Out of a million.
Yeah.
And then this is out of 500,000.
Yes. That's right, yes. Now 500,000 males and nearly 1 million females in the 85 group. But I don't know the number of cases. This is I got from the ONS, and it is only the deaths. So what I'm trying to say is, now this is the world, this was last week. World statistics, 38,000. We don't have to worry about all that. But what I want to show is why we are all getting worried is because of the media. Media is especially making people like Karunyan very anxious. Now, if you look at this, there are no additional deaths in USA. The number of deaths in the USA and UK and Mexico and in France is almost the same. And in Spain and Brazil, it's even more. So, you know, but because it's CNN and because all these people who are against Trump, they want to make it appear that the United States is dying because Trump is not doing things properly. Okay. And the number of cases, these are the number of cases per, yes, number of, total number of deaths in the country. This is last week. Okay, there were 215,000 deaths, and in England is 243,000. But in England now it's about 45,000 this week. Okay, right. This is in UK. The number of deaths from the October 10th to the October 16th, it has gone up. But the number of cases, you know, it's, yeah, it has gone up by 15,000 cases in that week, 19,000 cases. So it was climbing and now it's slowly coming down in UK. This is just to show the media, how they report. This is from Bloomberg on last week again. And if you look at this, they say there were US reported 59,000 new cases with the death toll of 217,000. They never say, they always try to show that this number of deaths is the fault of the administrators. And it's exactly the same that is happening in this country. This country, the media is taking our government to task every day. I know our governments made a very big mistake at the beginning by not having the not having PPEs and not being ready and this and that. But all these deaths, what I am trying to say, is not the fault of the government, it's the fault of you and I, that is the medical profession and the people who didn't know how to manage cases. Now with experience, we have learned how to manage, and now you can see the number of cases coming down. This is a very interesting, because I think we discussed this last time about Sweden. Now this is the cases in Sweden. I don't know whether you all can read all these. It's gone up, went down, and the number of cases are going up again. This is again October 12th, the last day. Number of deaths in Sweden. Now you can see it went up to 1,000, nearly 1,500 or something. Then it came down. On the 15th of October, there were 3 deaths in Sweden. From the 15th to yesterday, there were no deaths in Sweden. Not a single death, even though there were 1,000 cases every day. And yesterday, there were 7 deaths. So, now Sweden managed the coronavirus in a different way from all the other countries, except China and I think Southeast Asian countries and Sri Lanka, which managed in a different way. I don't think you need to worry about this slide. This is the same slide in a different. Okay, I think that's about all I want to say. What I want to say is, you know, this is from this morning's paper. Sorry, this is from this morning's paper. Today's Times, this is. Again, to show, now if you look at this, US has, yesterday there was 63,000 cases in the United States yesterday. And there were 54,000 cases in India. In UK, yesterday there were 20,000 cases, right? And this is the deaths per million again. Now, if you look, there is no increase in the deaths in US, in UK, Italy, Mexico. We are almost the same, Argentina. So I think you can't blame the administrator. My remit is to say that, you know, we can't be blaming the government for all what's going on. I think it's partly individual, ourselves, and partly that we didn't understand what it was at the beginning. Now, okay, this is a slide for Lawrence and Shanthy. This is also from this morning's paper. This is from today's Times, okay? Before the pandemic, the number of people suffering from depression or anxiety and various things from July to March is 9.7% of the population. And during the pandemic, it has gone up to 19.2%. This is percentage of children with probable mental disorder between 5 and 16-year-olds in England. In 2017 to 2020, between the boys, girls, and all. So, so that's all I'm going to say, because I am only going to defend my remit was to defend Trump, which I hope I have done.
but look at India.
Thank you, Narada. Sorry. Thank you, Narada.
Very nice.
Sorry.
Yeah, can I raise a point, Narada?
Yeah, you can.
India is 1.7 billion people.
Yes.
United States is 350.
Yes.
But still, United States death rates is higher than total death rates is higher than India.
No, that's right. Now, if you look, United States death rate, number of deaths is 2,200 and something, 220,000.
Yeah,
okay,
220,000. Yeah.
Okay, and in the UK it is for 44,000.
No, but
okay?
you can compare
now,
the two. We are 60 million people.
Wait. I'll tell you that. In UK, it's only 63 million people. So if you multiply this by 4 times, we come to the same as United States. the number of deaths is the same as in the United States. Why is it lower in India is, now in the definition of death in England is different. In England, the number of COVID deaths were calculated by the number of deaths of people in whose death certificates they have recorded the word COVID, or these people have had a positive test in the last 28 days. So if I had a positive COVID test 28 days ago, and if I die of kidney failure today, my account goes as a COVID death. Do you understand that? So the number of deaths in England, at least in England, I don't know about France, Germany and all. By the way, Germany has a much less, Germany is one of the European countries with the lowest death rate. I mean, the number of deaths they have recorded is only about 15,000, whereas we have 44,000. And so we don't know why that is. How you record the death. So in India, Maruf, people are, there is no testing. People are dying. You don't know where they are dying. And I think the statistics they are showing as the number of deaths are the people dying in hospitals, which are admitted to hospitals. So the death rate is much lower in India compared to other countries.
First of all, thank you very much, Narada. And I think Narada's presentation, I mean, I instead of countering the points or arguing for a different take, brings to problem, I think, a major issue that maybe Shanthy and Lawrence have to help us unravel, but we all have to be involved. And that is the nature of information that we are getting. Okay, the information at every point. Number one, the objective data and the definition of that objective data, and then the use of the data, whether it has secondary gain, like politicization or so on. And then, of course, what I think is a very, very dangerous thing that's happening is the massive infiltration of false information.
That's true.
Information that is believed by people. For instance, there are 3.5 million people who believe that Hillary Clinton and Joe Biden drink blood of children who are farmed and for health. So so there is a whole issue of the information, and then of course Narada brings a point that there are political motives behind the nature of information. Put it on both sides, Fox News on one side and CNN on one side, and this is not only in terms of the COVID and the political battles, but also in terms of daily life. And I think we should analyze that and get to a little understanding of, and then of course finally, it still mystifies me how good people can. So I mean, I'm telling my personal view. I mean, it's been an academic, intellectual pursuit for me to understand how certain people whom I know are pretty reasonable, good people still support, continuous lying, family separation. Like, okay, they are good folks.
Thank you for that.
And it mystifies me that this continuous liar, no one judges him. I mean, you don't have to go to CNN. I mean, this guy, go to Woodward's book, and go to what he says. He's going to go away in April. I mean, so, but still he's got support. So he's giving something to some people, and I don't know what it is. So it's a complicated thing. And I think we should have a session on that, and we have to have someone who has the wisdom and the breadth of understanding to talk about. Yes, Padmalingam, go ahead. You are muted, Mata. You're muted.
Unmute yourself, Padmalingam.
Can I ask Narada something?
Yeah.
You see, we are talking about statistics. Correct. I'm not disputing it. They are all deaths. But tell me, in the Trumpian country, if they had come in early and accepted what the science said, then did the prevention, the 220,000 would have been only 22. They didn't do that.
No.
That it is not one country being equal to the other country, They are all deaths and unwarranted, uncared for deaths. And that's what we are there to look after and answer for that. We can't say, the UK is equal to US equal to something else. No. Is 220 equal to another 220 deaths? 440 is as bad, isn't it? So prevention from the start, where we failed and who failed. That's where the answer should be.
Yes, Benita, the thing is, not only USA, even UK made the same mistake. We didn't, we were not prepared. Now, I will tell you something. Now, about pandemics, there was a big conference in the United States in 2016 and early 2016. And during Obama's time.
Salima,
I think you must go in. Huh? Right. About controlling of pandemic. And there was one, I think, even in the UK. And they suggested that to be prepared. But Obama didn't make any provisions for preparation.
That's not true.
No, Narada.
Yeah.
Your facts are. Hold it. Narada. Okay, two points of data. Okay, number one, Obama had a robust office after the Ebola of having a pandemic. Trump came and said, "I don't like doctors doing nothing," and he disbanded the border thing, and that's a objective fact. I can show you details of where he did, because Trump's problem was he can't conceptualize this. You know, you take the video, I don't know if you've seen the video by Bill Gates. Bill Gates in 2016 or 15, after the Ebola epidemic, clearly outlined, go and look at Bill Gates, and YouTube has it. He clearly outlined with maps that the biggest problem we are going to have is a viral illness, and we are not ready for it. You can't have guns and planes and bullets for that. And he gives out thing, and it was totally ignored. And I think the fact that office was created and it was disbanded, and at the transition, it was there's a requirement by law that the leaving administration gives a sort of hands over to the administration. And there was a meeting for a whole half day on pandemics, and the guy who ran it on Obama's side and the woman who ran it for Trump both cooperated, had a meeting, and there were about 20 new officials coming. Out of the 20 officials, 18 fellows have been fired. So they were not here when the pandemic opened. Okay, and then one guy was this stupid fellow who's fellow who wants to not count the people. He was sleeping the whole time. There are videos of him sleeping. So it is ineptness. So that particular fact is not quite right, Narada. But if you go to Fox News, they keep on saying that. Trump keeps on saying Obama left the cupboard empty. That's not a fact. It's a falsehood. But anyway, let me.
Yeah.
Padmalingam wants to say something. But these are issues I think we should have a discussion on the nature of information at some point. But Padmalingam, go ahead.
Can't hear. Padmalingam can't hear.
You're muted, Padmalingam. Unmute yourself.
Can't hear.
Until Padmalingam unmutes himself, I want to say a couple of.
Go ahead. Yeah.
First of all, I think we have to decide certain things on character, basic character of people, because that's what in the end motivates their thoughts, their words, their deeds, everything. And to us, Trump has shown himself as exactly the type of character he is in many, many ways, not in just one, on a daily basis. They go back and so on. So I think to me that has been a very important part of my thoughts and processes. The moral values, the moral compass by which guides a person, which ultimately leads to all their thoughts. Is it for me, for my benefit, or is it for the benefit of other people? How do you decide these things? And this is what this man in the White House at the present moment has shown to me. And so there is no way in heaven or hell that I will ever support a person like this. And I will probably do everything in my power to see that he's out as soon as possible.
Thanks for your comment.
Thank you. Thank you.
Patmalingam here. Again, my question will be for Narada. Last month, you made a statement that you believed in herd immunity. Do you still believe in herd immunity?
I do. Because if you take the Swedish, statistics, in Sweden, the number of cases went up in April, May. Hello? Yeah.
Yes.
And number of cases I'm talking, and came down. And now, of course, now I think Sweden has the most amount of herd immunity in the world at the moment. I think it's only about, still only about 20% or something, between 13 and 20%. Whereas all the other countries like UK and all, the herd immunity is very small still. And this is why we are getting second big number of cases and things like going up. Now you can see that in what happened to Sri Lanka. We had only about less than 200 cases. Someone brought some Indian guy, and now we have over 3,000 cases because there was no immunity in the. But anyway, that is by the way. The herd now take. I'm talking about the Swedish the statistics. Because the herd immunity is only 30% at the moment still.
No, 15.
No, I think in Sweden has the highest.
Yeah, so it's only 15.
15%.
Okay. Anyway, the number of cases have gone up again. Now, every week, every day they have about 1,200, 1,300 again, which went down almost nothing, and now coming up 1,200 cases. But the number of deaths are not going up.
Yeah, but that depends on the facilities available for treatment.
So why aren't the other
main factor?
So can I
more
just
than immunity, that's the main factor.
Can I interrupt for a minute? Can I?
Sure.
What I learned about the herd immunity is that the people, the entire crowd of people who are exposed, that was a theory that they will all get the herd immunity because the crowd is put together, like, when you contact.
In chicken
What
pox.
happened was, with the population being taught, using PPE, all the things, even though you put the entire crowd inside, 50% of the fellows were taking social distancing, wearing masks, washing hands, everything. That's why the herd immunity didn't develop and won't develop.
Yeah, can I just clarify the sorry.
Now is you are letting the horse out of the stable and looking for it now.
No.
Narada, can I just clarify the concept of herd immunity? Because it's been bandied around and I've tried to study it. I wish Banda was here to explain. Herd immunity is a condition when a sufficiently large number of the population has immunity, there is no place for the virus to take hold of and grow and multiply in a person for that person to be transmitted to someone else. So in where viruses are transmitted from person to person, if a sufficient number of population, say 80 to 90% is what they usually say, are immunized, then those who are unimmunized are protected because the odds of the virus being in someone being transmitted is low. Because for that, to have 80 to 90% immunized, for instance, in polio, is one place they tried to do the live polio vaccine. Because what they say is by people getting with this attenuated live polio, a lot of people got infected and therefore they couldn't transmit. So 30% doesn't provide herd immunity. you have to get 80 to 90% of the population immunized, and the only way we are going to get herd immunity in this thing is by mass immunization, vaccination. Now remember, in influenza there is no herd immunity. In certain other viral illness there is no herd immunity. Okay, now if you go to smallpox, polio, where there is universal vaccination, there is herd immunity. So Sweden doesn't have herd immunity. There are more people who are getting infected or not infected. That's a different story. But go ahead, Lawrence. Sorry.
Yeah, can I share the screen?
Yes,
you can.
Okay. The world has moved on. Whoops, can I get this? Let me move this. Oops.
Say one while you do that, Lawrence, and add another spoke into the wheel. What Karunyan said is absolutely right about the herd immunity. In Sweden, it's about 15%. That now we know that the antibodies that you have, it's not lifelong. You can get reinfection. So there is another question mark over herd immunity. I'm talking myself because I had COVID, I have antibodies. I need to know whether my antibodies level is still there after 6 months. So people are getting reinfection. The antibodies doesn't last a lifelong time.
Yes, I agree with that. I was going to raise that same issue myself. Thanks, Shanthy.
Okay, can I share the screen now?
Yes,
sure,
please.
go ahead.
Can you see the slide?
No, not share the screen.
No, we don't.
Fully.
Sorry.
What's going on? Okay, let's try this.
Share the screen. There you go.
Can you see it?
Yes.
Okay. I think Narada makes a very good point. We shouldn't listen to CNN or Fox News or MSNBC. We should listen to epidemiologists like Banda. And this is from the epidemiological site that compares different countries. Now, I don't know whether you know that Boris Johnson went for herd immunity when this whole thing started. I got phone calls from friends in the States, tell your government not to be stupid. And as you can see, this is what is called standardized mortality. You don't look at figures. That's what people on MSNBC do. You look at what the average number of deaths that you would expect for a given week in the last 5 years, and you aggregate it. That's a formula. And as you can see, the US and UK and Sweden, which is being put forward, had very high death rates, which they wouldn't normally have had. And remember, Sweden is a very scattered country. And if you have ever been there, you will know they've got amazing services. I went there for a conference and I went to visit a place. And they gave an alcoholic a flat in one afternoon, a fully furnished flat. Straight away, he went from the clinic to a fully furnished flat because he was homeless. I mean, their services are amazing. So talking of Sweden, where they did masking and distancing in a country that's not as condensed as we are, is a totally different issue. So listen to the epidemiologists, and they're very clearly saying UK, where Boris Johnson went for herd immunity, and I cannot tell you the number of people who shouted down the phone at me in January and February saying, are you guys crazy? That's why we have this crazy situation. And if you look at the countries that stayed cohesive, put through the measures of distancing, of hand washing, of masking, they have kept their death rates low. So don't take raw figures, do the proper epidemiology as Banda would have done. I'm sorry he's not here because I sent him a paper on clusters. There's something in that argument that the infection occurs in clusters, that it's 20% to infect the rest, but he hasn't come back to me. Okay, thanks.
I also wish Banda was here. He would have been a voice of information. Yeah, but anyway, very good. Any other comments to Narada?
Hey, Vikram Chandran, you didn't support me.
I do agree with Chandra just raising the panic, He's part of the other side of the equation.
No, there is
Can I just inquire who is iPhone 665?
They are other side of the equation.
iPhone 665?
Yeah. No. I think there is a balancing act, everything in moderation.
Yes.
I think
Other
there is
side
no
also
question.
realize that. Just running at that chap who Trump is not right. You see, you have not read enough papers on that chap. From the time that chap came in. Don't join the rest of the crowd. The statistics prove that everything that he claimed during the election, he carried out. No other president has ever done. Recently, one of the Democrats, Afro-American, he appeared on the television screen in the interview. He's not in media. He said the Negroes, for the last 40 years, all these government didn't do anything. But since Trump came, they have opened shops and they are doing better than under any other democracy. You see, these chaps are running the man down. I think it's good. And he's an evangelist, supported by the evangelist. Know that most of his voting comes from the evangelist. And they have written books about it,
Okay. No, we won't, sorry. No, we will perhaps have a different discussion. One of the things that I regret in my life in the last 4 years is I think I have spent too much time talking about Trump, such a destructive waste of time. But what we will do is we will talk about it in the facts. But I am suggesting that I appreciate the difference in viewpoints, and I appreciate that there are a lot of people who think differently. And that's part of the challenge of the modern era with the intercommunications we have. But coming down to two things we'll do before we finish. Anyone else has comments on either what Narada said or Lawrence said or Shanthy said?
May I make a comment? The number of cases that are infected, whether there are thousands or millions, doesn't matter. The measurement is the number of deaths that gives a definite finite value. But just because you get infected with the virus, it doesn't mean a thing at all. Mortality and morbidity is the
What about the long-term effect? Lawrence talked about the neurological effect, the seizures.
How can you make a long-term effect in 3 months when the disease has come? That's very bunker, you see. These chaps don't do enough research and they don't have enough putting.
Madan, let me just give you, flu comes and goes. And then
3 months, how can you? I said neurological damage, cardiac damage.
No, there are, okay. The course of recovery is not a smooth one as compared to the influenza virus. There are other viruses, something like chikungunya, which we had in Sri Lanka, where the residual effect of the virus goes on. And there's sufficient evidence now emerging. If you look at the good journals like New England Journal of Medicine or Lancet, that there is residual effects of the virus long for a long time. So if you don't die, you don't have a happy life. Not all.
These chaps who survive, they go through ICU, they get all the bloody treatment, they're put on the thing, they're left unconscious. They are due to drug effect rather than to viral effect, you see. So you can't, whether it comes from the top specialist, you have your bloody neurons to think for that, you had to follow what they say. 3 months is not enough in order to assess the effects of the disease. So I agree with the mental problem, with the restrictions and all. But the physical damage, I think is too short. Of course, it affects the neurological system, the cardiovascular system, and the muscular system. That might be part of that's a very small amount. The amount that they are statistically trying to put, I'm not taking very highly taken about that. But very small. And the people who are going to this treatment are old people, you see, older age group. The young chaps are quite all right. Say, Mr. Trump itself, he has the disease, is okay. They are started all right after the disease.
Karunyan.
I think I have got short-term memory loss. What else shall I
Shanthy, but I think you have also got nicer and lovelier and prettier, so maybe COVID is good.
Karunyan,
but I think what you're saying now really frightens me, because now we don't know the long-term implications of COVID. I think one has to pray and have faith and leave it to God. What happens, so what? take it. I
Okay.
think that.
All right.
No, now
Okay, someone else want to say something?
yeah, like Vikramachandran said, now our prime minister also had COVID, and he had bad COVID, not like Trump, and he recovered, but he took time. He took the nearly 3 weeks before he came back to his office. There are long-term effects. But none of the long-term effects, I mean, at least we don't know. As Vikramachandran said, it is too short a disease. We don't know how long it's going to last. But most of the things like tiredness, they eventually get better in about 6 weeks' time. About 6 weeks. Maybe it's longer. But what is happened in England, or at least in United Kingdom, is in United Kingdom, if you're ill, you're much better off. You get, now I know, now I think it was reported even in the Times yesterday, for example, there are, people want to have long-term effects because you can get registered. Now, I think Shanthy might contradict me here, but in England, it's good to have long-term illness, because you get a lot more benefits. Now there are a number of, I think in yesterday's Times, there were 2 or 3 cases reported where people who have recovered from COVID, but they have long-term illness, they are registered disabled. Once you are registered disabled, you get everything in this country. You get a car, a free car, you get a housing is paid, you get this, you get that, you get extra money, So with this COVID, I'm quite sure we are going to have a lot more chronic cases in England. Maybe I don't know about other countries, but in the United Kingdom, I have a feeling that we are going to have a lot more chronic COVID cases, because they are much better off by benefits.
Okay.
So you think having a car and benefits is going to outweigh having good health?
I think it does to a lot of people.
Okay, so I think we should have two.
I will tell you, Saro, in this country, about over 1 million people are registered disabled because of back problem. I know personally people who are registered disabled for back pain. They do all sorts of things, but once you get this, you go to a GP, you get yourself registered, and once you get the registered and this, you get all the benefits. This in England, a population of 60 million, I think nearly 10 million of the people are registered disabled. I hope Shanthy corrects me, my figures may be wrong, but
Narada, next time I won't come in because I'll be registered disabled.
Yeah.
Okay. No, I think that Narada is pointing to abuse of systems, and that's a human factor. Abuse will occur, and the same system that is abused is also used very appropriately. So there is a balancing. The fact that there is COVID is dangerous. At the same time, the impact of managing it can be bad, as Shanthy and Lawrence have told us. The question is, where is the balance? How do we find the balance? What is the source of information to find the balance? And how do we process that information? A fascinating question beyond whether one is right or wrong. So my suggestion is we can go on discussing, but before we go on discussing, I just want to suggest something going forward. So my suggestions are the following. We'll discuss going forward and then come back to this very stimulating discussion we are having. Okay, I would suggest, in my mind, I got 2 subjects to talk about, not necessarily medical. One is, I would love to have the equanimity and balance and judgment that Saro can provide us by giving us a talk on meditation. Okay. But Saro, can you give us a talk on meditation?
I have to say I don't have all this judgment and whatever stuff you're talking about, but
I think you have.
whatever little I know about meditation and what I practice and the benefits it has given me, that much I can give a very brief presentation. And I just wanted to add one thing more to Narada's association and Shanthi's and the UK people. In the United States, it's a little bit different. We have now possibility of a Supreme Court judge being appointed that's going to struck down ACA with the pre-existing conditions possibly being taken off. And this will really impact on the COVID possible complications. I just wanted to throw that in the USA, we are in a little bit of a different situation than in the UK. We don't have the good medical health and care that you have over there at the moment.
Yeah, that's a whole different discussion and debate, ACA and what it has done. And I think if I saw something positively good coming in the last 10 years, because I ran what is called a federally qualified health center, which was a health center for poor people for the last 10 years. And one of the true blessings and something that really provided dignity to those we served in the clinic was the ACA, Obamacare. The amount of health and dignity they got by having insurance. Because here people have no insurance. When you don't have insurance, you are an outcast. They don't have money to get sick. And when they get sick, they are broke and their houses get taken. We have a different system, but we won't go into that. But let me ask you a question. So Saro, you will give a talk for how many minutes, Saro?
Very brief, I don't know, 5-10 minutes?
Okay, can you take us through a little? So we will maybe take us through a little meditation session, maybe? No? How many of no?
I'm sure many people are aware and are doing it on, at whatever level, but I can tell you what I do, and that would be different.
Okay, all right. So we will have Saro as the second part. Anyone else has idea? And I have one idea, One of the things that's apparent from our discussion is how the same information that we see or the information from different sources are processed and so differently and so much different judgments come out of it. Okay, the classic example is of course Trump. Okay.
Fake news.
What's that?
Fake news.
Yeah, fake news. Yeah, whatever is fake news. Okay. Okay. So the question is the whole idea of information and the overload and how to process it and the challenges of that. Because going forward, that's going to be one of the modern challenges with all the internet available. It's not a medical subject. It's a sociological, psychological, political power, all kinds of combination. It's a fascinating subject to talk about. Does anyone want to take that?
Information filtration.
Information management.
Filtration for reality, real life.
The question will be, what is reality?
Yeah, that's true.
Yeah. So can anyone, is there anyone feels adequately capable to take that subject on?
You yourself.
No, I think I will have my biases. You have to have an unbiased. Lawrence, can you do that?
It'll take me time. I've got a lot of material. I'm collecting material on it. Okay, I'll try for next.
No, maybe we'll put it for 2 months from now. Now, next meeting will be end of November, right?
Then after the US election.
Yeah,
29.
Yeah. Okay. Next, I don't mind doing a part of it. I find the methodology that Trump has used to be fascinating. His approach to reality and the reality he tries to construct is a fascinating subject because I've compared it with a book I read on Third Reich. And so there are some thoughts in my head, not very scientific, but just opinions maybe. But I can give it a try. But I think it'll take time, as you say. Maybe if others are interested. Now, that's a suggestion. Maybe Lawrence, you try. I will also try maybe, and we'll try and have a session. But is there any other subject you want to talk about? Sorry, Lawrence.
I don't think Trump is an issue. Trump will survive. This is a larger movement that's sweeping across the world.
Yeah, I know. I agree. Trump may go, but the ideas he has put in and the things, there are lots of difference of framing it and understanding it, but, we can have
He's the front piece.
Karunyan, Patnalingam again. We have to at least have a discussion about what we can do if he wins again. He is going to win. So we have to have that discussion, I think.
Yeah, we will. By the time we meet next year, next month, we may, or most likely, fair good odds that we'll know the result, but we may not. But we will put that off if you don't mind. But I'm just to throw out some of the subject that people have. One of the other things that has bothers me personally, because it has also affected me and my family, is, going away from these things, is the number of early cardiovascular deaths and impairment, morbidity, mortality among South Asians. I don't know whether any of you have been impacted. Now, I had a nephew of mine who died when he was 48. He had a heart attack at 39. I got family members. So I have a personal interest in this, and we are all South Asians. Does anyone else wants to understand that particular phenomenon?
There is something called balanced life, Karunyan, balanced life, and I think it's very important. And in your WhatsApp group, I have put about 10 or 15 slides. Each one of those slides can be a presentation. It's a good one. Simple, how should we exercise, for example? How much time should we spend with the family? And how do we work-life balance? And these are all important. And I have put some topics in the group, and you can feed me back, and then we can design one presentation on that time.
Okay. But my particular point, Maru, my particular point,
yeah,
we have amongst our friends and families specific challenge of helping the next generation of South Asians, our people, Indians also included, same category of things, to have better cardiovascular and health. And what you are saying is a means to it. But there is also a whole physiology that has come out. There are books that are written on it, articles that are written on it, identifying the specific South Asian factor. It's still not very clear-cut how that varies from the others. But in the United States, a lot of doctors, young fellows, 38, 40, 45, are all struggling with heart disease. So the questions come, is it only lifestyle? Is it lifestyle plus medication? I know Milroy has, at one point at least, had a lot of interest in this. So my question is, could we have that as a subject? Would it interest people to talk about HDL? Sorry, Milroy?
I think that is a very important topic for all of us, for the younger generation, everyone. There are so many new theories, new ideas, and more and more stressing on stress. Meditation, this for heart disease, is coming into the mainstream, like stress, meditation, exercise, yoga, all that to be added to the mainstream.
I think there are several TED lectures on this subject. I think there is a lot of information. Anybody who wants to prepare a slide or present, Milroy, I can give you lots of.
So Milroy, see, my target population, to me, I'm becoming a preacher for young people's cardio health. And I send a lot of books. There's a book called The South Asian Health Solution by a fellow called Romesh Singha, who gives through the medical aspects of metabolism and lipid metabolism and atherosclerosis, and has a nice book that is readable to the non-medical person. So I'm sending it to anyone I know, because I'm thinking of the next generation, my children and my grandchildren and so on and so forth, because they still have the same propensity. So my question is, can we discuss it as a subject? And if so, who will take the lead to come out with the lecture? Milroy, will you do it? You were the health guy at one point.
Yeah, it takes some time.
Yeah, okay. So we have got 3 subjects. Anyone else has any other subjects to go forward?
Why you don't want to speak about diabetes, and then
Yeah, I can talk about diabetes. I mean, I can even talk about the
diabetes metabolic syndrome.
metabolic syndrome.
every eye in the world.
No, I don't think anyone will like metabolic syndrome compared to Trump and yeah. No, but I can do it.
Have a great weekend. I'm exiting. Thank you.
Okay,
Bye.
thank you.
Okay, bye.
Yeah.
Karunyan, maybe we can have something a little lighthearted as well, something like people's hobbies, something that they're pursuing.
Can I
Some
also be?
hobby. I don't have any, but whoever has some good hobby, for example, Bonitas with painting and things like that.
Let's suggest that everyone send a subject on their either an email, so I can coordinate with Karunyan and we put it to the table.
Okay.
And then we can
So
decide.
for the next meeting, what do we have? Saro is going to do a meditation.
Meditation.
Melita, can you tell us about your pottery for the next meeting?
Not now. Give me some time. You all of you discuss. Let me enjoy it later on.
No, listen.
Maybe a couple of months later.
Next meeting is 28th and 29th of November.
Yeah, it's one more month, Melita. What are you going to do during that 1 month?
No, what I mean is these are more important ones. No, we discuss it. If I have it ready, yes. Otherwise, I let make some slides or whatever that is and put it on or PowerPoint. Let me see.
So anyone else? Narada, Vikramachandran, do you want to say anything? I mean, we like everyone to.
What about Kodda's paintings?
And Glory hasn't opened her mouth. Come on,
You
Glory.
see her tonsils now.
What does Glory do? Glory, what are you?
Make people sleep.
I don't do anything.
Okay.
Right.
No, you Karunyan, you have two things now. One on meditation and one on the other thing that you are going to present. So we'll have a general discussion like this.
Okay, all right, fine.
Yeah.
Fine. Okay.
So I got a few things here written up: balance of life and meditation, and philosophy of fake news, information filtration, balanced life, and cardiac health. So we have.
Okay, all right. So circulated and will, yeah.
I suggest that you all go through the quips I put, and I have one slide, parting slide for you from Shanthy's presentation. Okay. You all will just have that, look at that slide. That will give you an idea what to do.
One last thing, Maru, before we go. Lawrence, when is your magic show?
Yeah.
I can do it next month.
That's a good idea.
Yes,
okay, so
I think that it will be good. And I agree with that, with what Saro said. Let's have something light-hearted.
Okay, good.
Yeah,
okay.
Here is your slide.
Agreed. Okay, so next month is Lawrence's show and then Saro.
Yeah.
Okay. So who goes first is the question.
That they can decide.
Do the meditation first.
Work first, pleasure second.
To see Lawrence's magic show.
Okay. Now, there is this slide, and I'm going to send you the presentation anyway. It has various things that we could do that we can completely utilize. It is somewhat that what we discussed at the end. Yeah. Relaxation, yoga, aerobic exercises, prayers, creating activities, positive thinking, installation of hope, reading, music, online learning courses, indoor plays, and these are the main things. So I think that gives you an idea that the balance of life is more towards having a balanced life between what you have at home, what you have outside.
Whose slide is that?
It's
Shanthy.
No, not mine. I think Maharoof is good. Yeah, I think Maharoof made that slide.
Yeah, Maru also had structure.
Yeah, okay. I have another one on structure in lifestyle, but that's the whole thing. Another one. Okay, so I think what we need to talk about is balanced life, and the more balanced you are, the more longer you can last.
So Saro's Saru's talk will be on balanced life, because meditation is a form of balancing your life. I mean, we all have unbalanced lives, so
mind and emotion.
Yes, mind in motion. That's correct.
I know.
Okay, I can help. If any of you need any, I can plan out the whole thing for you, and then I can provide you with slides and things like that, and we can have reasonably. You can write out the points, and then I can bring up whatever material, drawings, and things like that for you.
Maruf, what's the best email address to communicate with you?
hmmaruf@gmail.com. It's in the announcement.
So it's all lowercase?
Yes, all lowercase.
Great, wonderful. Thank you, Narada. Thank you,
everyone.
Thank you, everybody.
That's a very, very interesting way of looking
Narada,
at it.
is this the last presentation that you sent, or is it something you modified afterwards, or you have added things? So can you send the last one that I will?
And Lawrence, you are going to put a little words of wisdom for the rest of the world to.
Okay.
We will do it in 2 months' time, in December, during Christmas time.
Yes, I'll coordinate.
Can I leave you all now?
Yeah, sure.
Okay. Thank you. Thank you. But go to sleep, Benita.
Now, I just want to know who is iPhone 665 for information.
See you all.
Can you unmute yourself and let us know who it is?
That must be the Trump's national security advisor. I don't know. iPhone 665.
You know, I have a suggestion. I think we should have a very short discussion after the 4th to see how Karunyan and Saro and all are coping after the 4th.
We won't know on the 4th.
We won't know on the 4th.
We won't know.
Essentially, the calculation on the day of the election, some reports will come. And there are about 6 states that matter, 6 or 7 states matter. The rest of the states don't matter. California, New York, Chicago, Illinois, doesn't matter. Okay, that's on one side. And then there are other guys like Montana and other things, they don't matter. We know where they are. There are 6 states that are going to be. Now, of the 6,
but also the Senate will matter a lot.
Yeah, the Senate is a different story. Yeah, Senate is, I'm talking the presidential. So
Very
if most likely on the same night, you'll have Florida saying and Arizona saying. If Trump loses both those, any one of those, goodbye to Trump. He'll have to go to jail. Most probably he'll go to jail because he has robbed so much. He'll have a lot of issues coming. Okay. But if those are not, if Trump wins that, then he still has a 30-40% chance.
Tasim, are you with us? You can unmute yourself. Tasim is in here.
Yeah.
And I want to know who is iPhone 665. Still don't know.
Okay. I have a strong feeling that this is a spy from the.
No, I can't.
Karunyan, you and I are in trouble.
I know.
Yeah.
We will be deported, Saroj. We will be deported without our children. Yeah.
Okay.
Hey,
everybody.
All right.
Thank you very much. Wonderful. Thank you all for wonderful.
But this time it we swallow up to 19 only. I think last time we had more than 20.
Yeah, you know, Vijay didn't join.
Banda was not there.
Vijay didn't join. Banda didn't join.
So
I asked Mary to join, but Mary didn't want to join. I think if you persuade her, she'll come.
2 o'clock. So the clocks are changed.
But thank you all. Especially those Australians and New Koda. Thank you very much, Koda, for staying on.
And thank you, Maruf, and thank you, Karunyan, for interesting meeting. And
thank you. We need the stimulation that comes from presentations such as yours. The other side.
Yeah, that's true.
Appreciate that. Yeah. Otherwise, it will be boring.
Okay. Bye.
Bye.
Bye. Have a good day.
Bye.
Thank you. Karunyan. Thank you.
Thank you, thank you, thank you.
You.
Losing. Tasim, are you there? Tasim? Yeah, you are. Still no response from 665.
Maruf,
Yes. Tasim?
do you hear me? Yes.
Yeah, I do.
Yes, I was listening to another
Yeah, I know.
high flown discussion. It's entirely not my subject. So I
I
was
know.
completely, but it was interesting. I mean, part of the.
But you could come on the video. What happened to your video?
Do you see me now?
No, not yet.
Can you see me?
You have a video at the left bottom corner. Stop video.
Uh-huh.
Start video. Are you on a laptop?
Yeah, no, I'm using my phone. Oh,
Phone.
okay, there I am. That's it. No, my phone. Can you see me now?
Not yet. Your video is still muted.
That's funny.
Your
It's
video
muted. No, I started the video. I still not
there
there.
is somebody with iPhone 665. I don't know. There you are.
There. That's good. That's me. Hi. Yes.
All right.
Right.
People
That's
are
very
lovely to see
interesting. Yeah, I know, partly because, but half the guys I can't recognize,
Yeah,
honestly.
I know.
Okay,
But their
Narada
names are
I was
there, excepting this
actually-
iPhone 665. He's still connected, but I don't know who it is. Kodikara was there, he gone. Lawrence had two connections, one through his wife,
Yes.
Hillary, and this is his own. I think he connects to have a backup.
It's nice to see. It's nice to see you.
Yeah.
Yes. So how? Otherwise, hey, when is your birthday?
Oh, 24th of September. Today is 24th of
24th
October.
of September.
Exactly
That's
1 month
right.
later.
I remember somebody was 24th of September. I couldn't remember this.
I'm going to stop the recording. I think it's recording.
So shall I knock off the recording?
No, it's okay. I knocked off the recording. We are still on live on the YouTube.
Yeah.
Then
So otherwise, you're still in England, are you?
Yes, at the moment, because I was supposed to go, but then there was some administrative problem with my visas, and then I sorted that out, and hopefully next Wednesday I'm going.
So
you'll be here all this while, and
you'll be going to Saudi.
Saudi, yes.
I see.
Ranjit has gone. Everybody has gone except you and me. I think iPhone 665. I said, can you please identify yourself, and he hasn't done that.
But we don't know who it is.
Yeah. So we need to identify because
family all right?
Huh?
Family okay?
Family is fine. I am in my home here.
I see.
You know, it's
your
virtual
background has a
background. I'm in the sea.
your virtual background. I know. I thought you're probably somewhere in Vatican or somewhere.
There you are. This is my home.
Oh, that's right. That's okay. Right. Yes.
I put the sea. It's more calming to people then.
Oh yeah, that's right. That's good. Well, I was happy to see.
At least I was
Norman.
wanting to see you, but then you wouldn't respond. So I was
Yeah,
calling Kasim.
I didn't know which one to sort of. There was something unmute and all that sort of thing.
Yeah. No. You have a speaker. If you come on the laptop, it's much easier, and I can direct because this is on the phone. It is a little different, but I have connected by phone also. But
My video, I haven't got a camera. You know, I must get a camera.
Get a camera. It's easy. Yeah.
Yes, it's easy. That's not a problem.
Yeah. Salima was sitting behind me, and she was connected also.
Was she? Oh, that was interesting. But you guys are very high-flown discussion, and we heard a lot about Trump. I didn't realize that.
The guys are teetering on politics, but I don't want to put a
who was talking for Trump just now?
For Trump was Narada. And
No. Narada was not for Trump. There was another guy.
Yeah.
Who is he?
Vikramachandran.
Vikramachandran. He was talking highly of Trump. He seems to be enamored. One of the I was a bit surprised.
Trump has positive and negative. Positive, he has made money. Negative is he's not fit to be a president, unfortunately. I think he is leading.
He's very rude and uncouth. You know, I mean, not as a. He doesn't have any presidential qualities about him.
Yeah, definitely not.
What time? What is the time there now?
It's almost 5 o'clock. At 5 o'clock, I start a Quran class.
Oh, interesting.
we read Quran together and go through. We are going to go through Zalzila, you know, about the final shaking of the whole world. And these guys are talking philosophy.
I didn't know you were that. I didn't know you were that religious.
Go and have a look at the thing I put on.
You sent me some.
No. Today I sent you some invitations.
Yes.
I'll send some now, right now, so you know.
But how do I tap into that?
Just you remain here. You will find them joining us. It's just the same password, same ID. You know, this is my meeting.
Oh, I see. This is your ID. Okay, I'm losing a lot of my